how to determine the final result after the surgery. Why we have asymmetry after the rhinoplasty, how to correct the asymmetry of the surgery. Hello friends, hello colleagues. Today I will show you how to determine the final result after the surgery. As an example, I will show you this case. This is the photo before the surgery and this is the photo 2 months after the surgery. What can help us to understand when we have the final result after the rhinoplasty? The answer is ultrasound examination. When we do ultrasound examination before the rhinoplasty and after the rhinoplasty, we can measure the thickness of the layers of the skin and also the thickness of the layers above the cartilages. And after the rhinoplasty, we can compare before and after layers. And we know if the thickness of the layers the same, for example, 90% we have the final result. When we are doing the ultrasound examination, we can control the position of the cartilages before and after. We can see the stitches, we can see the scar tissue, and we can see the symmetry of the structures and of the elements. It really helps to understand, should we do the correction after the rhinoplasty, or maybe we just need to wait and everything will be good. This is results before and after. In this picture it seems like it's good final result, but maybe it's not the final result. Again, we are doing ultrasound examination. We can compare before and after picture. Before we saw the bone, the upper lateral cartilages, all the layers of the skin, the layers above the cartilages and the bone, and we can compare these two pictures before and after with after position of the bone, with position of the cartilages. We can analyze the thickness of the SMAS, we can analyze the thickness of the derma, and we can analyze the position of the cartilages. And when we compare before and after picture, we understand that after 2 months, in this case, we have final result. Also, ultrasound helps us to understand the thickness of the skin. Maybe we need to treat the skin before the surgery or maybe after the surgery. This is the example of thick skin. You can see the thickness, the distance from the upper layer of the skin to the cartilages. And this is an example how ultrasound examination helps us to understand why we have asymmetry after the rhinoplasty and how we can do the correction of the rhinoplasty after the surgery. So this is the result before and after. We can compare two noses. It seems like okay, nice beautiful nose, new beautiful shapes, lights on the tip of the nose. This is the 3/4 view before and 6 months after the surgery, the side view before and 6 months after the surgery. But when we are looking carefully in black and white picture, we can see that something not perfect. The tip of the nose is not on the right straight position. Yes, the face is asymmetrical, but the tip of the nose is looking to the left side more. But why we have this asymmetry after the surgery? And the main question, how to correct the asymmetry of the surgery? Ultrasound examination gives us the answer to this question. We have this asymmetry because of the asymmetry of the lower lateral cartilages. Maybe it happened because of the stitches. Maybe it happened because of the wrong, incorrect measurement of the cartilages, but it is very easy to correct this asymmetry. So again, ultrasound show us that it's not the swelling, it is not scar tissue, for example. What we need to do is just to make the right lower lateral cartilage shorter. And it's easy to do this correction by local anesthesia, and it takes just 5 minutes. So again, this is picture before and this is picture after the surgery. And here we see that the length of lower lateral cartilage from the right side is a little bit longer, just 2 millimeters. So we understand that we can overlap the cartilage by local anesthesia, and we will fix this problem very easy. I hope this information will help you to determine the final result, and of course to avoid the corrections or to help make it very easy and fast. Thank you very much.